podcast in 5 minutes from RP English Podcast.
Security to the ER.
Good afternoon. I'm Dr. Smith. What brings you to the hospital today?
Good afternoon, doctor. I was bitten by a dog this morning.
I see. Can you tell me exactly what happened?
I was walking near my house when a dog suddenly bit my leg.
When did the bite occur?
About 6 hours ago.
Where on your body were you bitten?
On my left lower leg.
Did the bite break the skin?
Yes, it did. It bled a little.
Do you know the dog, or was it a stray?
It was a stray dog.
Did you clean the wound after the bite?
I rinsed it with water.
Have you ever received a rabies vaccine before?
No, I haven't.
When was your last tetanus shot?
I'm not sure. Probably more than 10 years ago.
May I examine the wound? Oh, you have a puncture wound with mild redness, but no signs of severe infection at the moment. First, we will clean the wound thoroughly with soap and antiseptic. This is very important to reduce the risk of infection. We will also prescribe antibiotics to prevent a bacterial infection from the dog bite.
Will I need stitches?
At this stage, we prefer not to close the wound tightly. Leaving it open helps prevent infection. But you need rabies post-exposure prophylaxis. This includes the rabies vaccine is given on several days: today, day 3, day 7, and day 14. It is very important that you do not miss any doses and rabies immunoglobulin because it's break the skin.
Is rabies dangerous?
Yes, rabies is almost always fatal once symptoms appear, but it is completely preventable with proper vaccination.
I understand. I'll follow the schedule.
At home, please keep the wound clean and dry, take antibiotics exactly as prescribed, watch for signs of infection such as increasing redness, swelling, or pus. Avoid touching or scratching the wound. Please return to the hospital immediately if you have fever, increasing pain or swelling, red streaks spreading from the wound, numbness or weakness near the bite area. Also, come back to the hospital if you miss any rabies vaccine appointments.
Thank you, doctor. That's very helpful.
In this episode, let's focus on 4 important words you often hear in dog bite cases. First, stray. Stray means an animal without an owner, usually living on the street. In medical practice, bites from stray animals carry a higher risk of infection and rabies. For example, the patient was bitten by a stray dog. Next, aggressive. Aggressive describes behavior that is violent or likely to attack. Doctors often ask if the animal was aggressive because abnormal aggression can be a sign of rabies. For example, the dog appeared aggressive before the attack. Vaccination. Vaccination is the process of giving a vaccine to protect against a disease. In dog bite cases, rabies vaccination is critical to prevent rabies infection. For example, the patient requires rabies vaccination. Exposure. Exposure means contact with something harmful, such as a virus. A dog bite is considered rabies exposure until proven otherwise. For example, this bite is classified as rabies exposure. These 4 words are essential when assessing dog bite injuries. Practice saying them out loud and your medical English will sound more confident. Follow RP English Podcast for more real medical English.